Did you go into neurosurgery because you hated rectal exams? Well, I've got some pretty bad news for you. You guys did pretty well on this quiz that I gave you. I'm seeing a lot of correct answers in the comments. And what I'm trying to differentiate here is the difference between spinal shock and an incomplete spinal cord injury. So in both of the cases I presented, you have a young male after an MVC, which is going to be a high impact injury, presenting with flaccid paralysis and sensory changes below the nipple line, which is approximately T4. So it's reasonable to suspect that he has some kind of injury to the spine causing these symptoms. Spinal shock is a temporary condition that often accompanies spinal injuries. Patients are going to present with flaccid paralysis and complete loss of deep tendon reflexes. They tend to recover from this over a couple of days to weeks. Spinal shock is diagnosed by the absence of the bulbocavernosus reflex, which is an interneuron-mediated spinal reflex at the level of about S2 to S4. So that's going to be below the level of most spinal injuries. That's why we test this. So this reflex is tested by doing a digital rectal exam. So first you're going to check for rectal sensation and tone. If rectal tone is absent, this reflex is elicited by genital stimulation, either by pulling on the glands or the clitoris or a gentle tug on an indwelling Foley catheter. When the reflex is intact, this stimulation will cause contraction of the anal sphincter, which you will feel during the rectal exam. If there's no contraction and the anal sphincter remains relaxed, that's an indication that this patient is experiencing spinal shock. Return of the bulbocavernosus reflex means that the spinal shock period has ended. Now in patient B, they have what's called an incomplete spinal cord injury. This is assessed using the Asia scale. This ranges from Asia A to Asia E. Asia A is what we call a complete spinal cord injury, meaning at the level where the injury has occurred, the entirety of the spinal cord has been injured and affected. Spinal-mediated reflexes such as the bulbocavernosus reflex will still be intact because, again, this is mediated by the interneurons at the level of S2 to S4, which is below the level of the injury, so this reflex arc can still continue. Patients with any amount of sensation or muscle activation have what's called an incomplete spinal cord injury, and these are the patients that we take to the operating room immediately. Patients with incomplete injuries are much more likely to have return of function following rapid intervention in order to stabilize them and decompress the spinal cord. So now you know a little bit about the difference between the presentation of spinal shock and a spinal cord injury. I'm proud of you guys. So many of you have been studying. I'm proud of you guys. I can tell a lot of you have been studying. Good job today.